Dean and faculties of School of Allied Health Sciences, we welcome you all to the second session, which is on hypertension. For this session, we have our distinguished speaker, Mr. Jason Samuel, Assistant Manager, Apex Kidney Care, Mumbai, Maharashtra. He has been a dialysis technologist with more than 8 years of experience assisting renal failure patients before, during, and after procedures. Completed his bachelor's in dialysis technology at Sri Ramachandra University, Chennai during the year 2007 to 2011. Specialization in renal dialysis technology under the Department of Nephrology at Sri Ramachandra University, Chennai. He has completed a project titled Outcome of Dialysis Patients from Intensive Care Unit in the year 2011 from Sri Ramachandra University, Chennai. He has worked as clinical executive in Ferencis Medical Care, Hyderabad in the year 2011. In the year 2012, he is a dialysis therapist in Devita or Nephrolife. In B.N. Patel Institute of Paramedical Sciences, Gujarat, he has worked as dialysis technologist and also as a tutor in the year 2007. He is working in Apex Kidney Care, Mumbai. He has handled lectures for the dialysis technology students, handles patients, supervises the technicians during the procedures, and also he acts as a visitor to other Apex centers in and around Mumbai as a quality control manager. With immense pleasure, I now welcome Jason sir to take over the session. Thank you, sir, for accepting our invite and coming up for the conference.
Welcome and thank you so much for you all that you have. I am so privileged to take a lecture for those students who are pursuing allied health science courses. Okay, so now
Yes,
I'll move on to the topic.
yes,
That is hypertension. So hope you all can see my screen.
yes, sir, it is
Okay,
visible,
fine.
sir.
Okay, so hypertension. So, what do you mean by hypertension? That is the blood pressure. That is, it is defined as a lateral pressure exerted by the contained column of blood on the walls of arteries. That is, the blood pressure is a measurement of force applied on the artery walls. Okay, that is a pressure which is applied on the walls of the artery. So it currently measured by hypertension. That is increase in blood pressure. Normally, we call it as increase in blood pressure. Actually, it is termed as as you all know that the normal blood pressure it is 120 by 80. That is 120 systolic pressure and the 80 is the diastolic. So that is a normal. So in this term hypertension, it is termed as greater than 140 millimeter mercury systolic and diastolic lesser than greater than 90 millimeter mercury. So this is given. This definition was given by JNC. Okay, that is JNC stands for Joint National Committee. Okay, committee. So it's mostly the causes of hypertension is unknown due to several reasons. The hypertension acquires for the people. Okay, so those conditions like smoking, those who smoke continuously, so they will get this hypertension. Then being overweight or obesity, and people those who have a lack of physical activity. For those people, those who take excessive salt intake, dipsomaniac. What do you mean by dipsomaniac? That is those who are drunkard. We call it as dipsomaniac. Stress, old age people, genetic disorders. So genetic, here the genetic it is a very rare causes. Okay, it is caused by the mutations in particular genes, many of which it help to control the balance of fluid and salts in the body, and also it affects the blood pressure. But this genetic cause is very rare, and a family history of hypertension, that is a hereditary disorder, uh, chro- chronic kidney disease, adrenal and thyroid disorders, and finally sleep apnea. For those people who are having sleep apnea, they are also having they can also have more chance of acquiring this hypertension. Oh, because what first of all, what do you mean by sleep apnea? That is, a sleep apnea means there is serious. It is a sleep apnea means it's a serious sleep disorder in which breathing repeatedly stops and starts. Okay, it will not stops completely. After some time it will start. So they will give a, so unknowingly there's a break in breathing. Okay, so if there is a sudden drop in blood oxygen level that occurs during sleep apnea, increases the blood pressure. Understood? And this can strain the cardiovascular system. So that's why sleep apnea is also causes of hypertension. Okay, so the major classification of hypertension, it is divided into primary or essential hypertension and secondary hypertension. Here, the primary hypertension, it is the causes unknown. Mostly 80 to 85% are having hypertension. It is from this type. Okay, so these are the factors under that is genetic factors, racial and environment factors, risk factors modifying the course of essential hypertension. Okay, first we'll see about the genetic factors. That is the role of heredity in the etiology of essential hypertension has long been suspected. The evidences in support are the familial aggregation, occurrence of hypertension in twins, epidemiological data. That is, epidemiological data means that is deals with the incidence, distribution, and control of diseases, and the identification of hypertension susceptibility gene. Okay, and in the racial and environmental factors, that is, a various environmental factors have been implicated in the development of hypertension, including excessive salt intake. Okay, so why excessive salt intake is a major cause of hypertension? Because salt contains one, that is sodium. So if there is intake of more sodium, that can lead to hypertension. Okay, obesity, that is, if a patient's body shape is too large. So, what is the main function of heart? To supply blood to all parts of the body. If your body is too, if the person's body is too large, so the heart, the burden of the heart will increase. That is, the workload of the heart will increase. Okay, and so that the heart pumps the blood vigorously, and normally the blood pressure also increases. Okay, so these are all the factors. These are all main factors of having hypertension. Then job strain, for those people, those who are straining themselves in their job without taking rest. They are working day and night. Okay, and individuals under high stress. Okay, for those individuals having high stress, even this job strain, that can lead to more stress. Okay, and these are risk factors modifying the course of essential hypertension. So the course of essential hypertension that begins in the middle life is modified by number of factors. So those factors are age, gender, atherosclerosis, and other risk factors. What do you mean by that is atherosclerosis? That is, atherosclerosis, you can see the picture here, due to the accumulation of fibrofatty plaques in the artery. Okay, which makes the passage narrow. So in this particular area, the blood pressure will increase. Okay, that is, the arteries become narrowed and hardened due to the buildup of fibrofatty plaques. Okay, and the classification of primary hypertension is divided into benign and malignant. Okay, in benign hypertension, it is symptomless, and it will not, it is symptomless, and it will not cause any dangerous side effects. Okay, the word benign stands for gentle, but it is not harmful much. Okay, so if this benign hypertension, it is persistently, it is increased, that can causes the development of vascular, cardiac, or renal diseases. Okay. Malignant, opposite of benign is malignant. Malignant is worse. Okay, that is a severe form of hypertension leading to the progressive cardiac and renal damage. That is can lead to progressive cardiac and renal disease. Okay, and the other name of malignant hypertension is accelerated hypertension. Can causes damage to all organs. So it is fatal, always fatal, and causes death within few years. Okay, the risk factors are genetic susceptibility, age, obesity, salt intake, alcohol intake, smoking, lack of exercise. Okay, so these are all the major risk factors of malignant hypertension. Now we'll move on to secondary hypertension. So secondary hypertension is caused by another medical condition. Okay, another medical condition, for example, the diseased kidneys or arteries or heart or endocrine system. So if the heart is diseased or if the kidney is diseased, that due to the diseased heart and kidney, that will increase the blood pressure. Okay. So secondary hypertension is classified into the major causes of secondary hypertension is due to cardiovascular system. That is atherosclerosis. Already I have mentioned you. Okay. Next is endocrine. Endocrine dysfunction. Due to endocrine dysfunction, what are the diseases leads to hypertension? That is hyperthyroidism. What do you mean by hyperparathyroidism? Hyperthyroidism. That is the workload of the thyroid. That is overactive thyroid gland produces more thyroid hormones. Okay, that is the thyroid hormones include T4 and T3, that is especially this T3 dilates the resistant arterioles, reducing the systemic vascular resistance and increases the cardiac output and pulse. So this is how the blood pressure is also increased. Okay, and hyperaldosteronism. That is hyperaldosteronism? It is a hormone produced by the adrenal glands. Okay, the adrenal glands where it is situated? It is situated above the heart. Sorry, it is situated above the kidney. Okay, a superior portion of the kidney. So, what is the main function of this aldosterone hormone? That is, it plays a major role in maintaining the major role in blood pressure. Okay. Next is renal hypertension. So, renal hypertension is caused by renal artery stenosis. Stenosis means what? That is the renal artery stenosis means that is uh, the narrowing of renal artery. Okay, mostly this kind of problem it occurs in old age people. Uh, and next is what? That is glomerulonephritis. So glomerulonephritis, that is the inflammation of the nephrons, inflammation of the glomerulus. Okay, typically caused by an immune response. Okay, so glomerulonephritis can lead to kidney disease and that can causes high blood pressure. Okay, and next is neurogenic causes. Neurogenic causes, it can causes increased intracranial pressure. Okay, that is the intracranial pressure. That is what is present in the cranium. That is uh, cerebrospinal fluid, no? So how the pressure in the cranium increases? That is increased in intracranial pressure can be due to rise in pressure of the cerebrospinal fluid. So the pressure in the CSF will be increased. So due to this increase in the pressure, CSF pressure, this is the fluid that. So what is the main function of the CSF? Main factor of the CSF, that is it that is this fluid is a fluid that surrounds the brain and heart. Okay, so brain and spinal, not heart, brain and spinal cord. So the pressure can damage the brain or spinal cord by pressing on important structures and by the restricting blood vessels. So the blood vessels will be restricted due to the increase in intracranial pressure. So if the due to the restricting blood flow, the heart tries to pumps more blood so that adequate amount of blood will be sent to the brain. So this can increases the blood pressure. Understood? Now coming to the renal hypertension. So hypertension produced by renal diseases is called renal hypertension. So the renal hypertension is divided into renovascular hypertension and renal parenchymal hypertension. First means and other in either cases, renal hypertension can be produced one of the three interrelated pathogenic mechanism, that is activation of renin-angiotensin mechanism, sodium and water retention, and release of vasodepressor. First, we'll go into activation of renin-angiotensin mechanism. Okay, so if there is decreased cardiac output, okay, for example, if a person is having less body fluids, that is the patient is hypovolemic, that is his body has less fluid, so that can lead to decreased cardiac output. So decreased cardiac output can lead to renal ischemia. So renal ischemia that can causes decreased GFR. Okay, so the glomerular filtration rate will be reduced. There is renal ischemia. And renal ischemia, if there is a decreased GFR, that can lead to the stimulation of JGA. So the JGA cells, that is the juxtaglomerular apparatus cells, gets stimulated, and it produces a hormone called renin. Okay, so the what is the main function of this renin? Renin is a hormone produced by the kidney, which helps in maintenance of blood pressure. Okay, so now I'm going to teach you how this renin increase the blood pressure. That is, already in the blood you are having angiotensinogen. What is that angiotensinogen? It is a glycoprotein produced by the liver. Okay, this renin goes and converts this angiotensinogen to angiotensin. Okay, and angiotensin 1, what is the main function of angiotensin 1? It is not known for any biological function. Okay, but it is a precursor of angiotensin 2. Okay, so this angiotensin 1 is converted into angiotensin 2 in the lungs. Okay, in the presence of in the presence of angiotensin converting enzyme, which is produced by the lungs. Okay, the conversion of angiotensin 1 to angiotensin 2, it happens in the lungs. Okay, because in the lungs only it produces the angiotensin converting enzyme. Okay, and this angiotensin 2 is a potent vasoconstrictor and also stimulates the adrenal cortex to secrete aldosterone. Okay, so angiotensin 2 leads to vasoconstriction. So what is that vasoconstriction? That is, the blood vessels become narrow. Okay, and also angiotensin 2 stimulates the adrenal cortex to secrete aldosterone. Okay, already I told you about aldosterone. Okay, so aldosterone promotes the reabsorption of sodium and water. So this reabsorption of sodium and water, it happens in the kidney. Okay, and this can leads to hypertension. Understood? So aldosterone promotes a reabsorption of sodium and water, and this increases the blood pressure and causes edema. Next, coming to sodium and water retention. So sodium and water retention is by the blood volume and cardiac output, both of which have a bearing on blood pressure, are regulated by blood volume of sodium, which is significant for maintaining extracellular fluid volume. Okay, and release of vasodepressor material. A number of vasodepressor materials and antihypertensive counterbalance of the vasopressor effect of angiotensin 2. So these substances includes prostaglandins. So prostaglandin also, it is one of the hormone produced by the kidney. Okay, that is mostly it is secreted in the interstitial cells of the medulla. The main function of this prostaglandin is for vasodilation. Okay, vasoconstriction and vasodilation. constriction and dilation of the blood vessels. That is the main function of prostaglandins. Next is urinary kallikrein and kallikrein kinin system. What is this urinary kallikrein and kinin system? This that is, it consists of blood proteins that play a major role in inflammation, blood pressure control, and coagulation pain. Okay, so that is a main function of this urinary kallikrein system. And next is platelet activating factor. This platelet activating factor, that is, it is well known for its ability to cause platelet aggregation, inflammation, and allergic response to very low concentration. And okay, and the other clinical features are like headache, blurring vision. Patients, they will not able to see properly. Facial edema will be there. That is facial puffiness. Edema can occur. Cardiac failure, papillary edema. That is papillary edema means what? That is swelling the eyes. Okay, papillary edema and hypertension, which it is uncontrollable. Okay, and the investigation, it can do renal angiogram, ultrasound duplex Doppler, isotope renogram, and renal function test. The complication can lead to hypertension encephalopathy. What do you mean by that hypertension encephalopathy? That is, it is a it is a brain dysfunction due to significantly caused by high blood pressure. That is, um, patients are getting brain dysfunction that is caused due to high blood pressure. Okay, and acute or chronic renal failure, ischemia, stroke, cardiac failure, and cardiomegaly. Cardiomegaly means what? That is, cardiomegaly means that is the enlargement of the heart. Treatment, and treatment, we can give antihypertensive medications like AC inhibitors, beta blockers, calcium channel blockers, and loop diuretics. Surgically, we can also do treatment by doing a bypass grafting or acute transplant nephrectomy. Diet, it can be diet, we can manage diet through by giving protein, salt, saturated fat diet restriction. Okay, next, coming to renal parenchymal hypertension. That is a high blood pressure secondary to renal parenchymal damage. That is due to the damage in the kidney that causes high blood pressure. Okay, so the hypertension due to chronic renal parenchymal disease is the most common form of secondary hypertension. It is an incurable form of hypertension and only can be managed. Causes, that is, these are the main causes: primary glomerular nephritis, nephrotic syndrome, uh, systemic lupus erythematosus. That is, what do you mean by systemic lupus erythematosus? That is, it is an inflammatory disease which it can affects the joint, skin, kidneys, and blood cells. Okay, it is an autoimmune disease, and polycystic kidney disease. It is an hereditary disorder due to the it is an inherited disorder in which the clusters of cyst will be there on the present on the kidneys. Diabetic mellitus, amyloidosis. Okay, then PSGN, that is post streptococcal glomerular nephritis, and diabetic nephropathy. So these are the major causes of uh, renal parenchymal hypertension. So we'll see the pathophysiology. So due to the renal parenchymal damage, it can leads to local ischemia. Local ischemia leads to sodium restriction, and this increased blood volume, and finally it leads to hypertension. Other clinical features of secondary secondary hypertension, that is renal parenchymal hypertension. So mostly patients will be asymptomatic. It is an uncontrollable hypertension. Mostly you can will be seeing it in young patients. Other clinical features, they will be having headache, palpitation, puffiness of face, edema, dyspnea, and it can be investigated by renal profile, 24 hours urine protein, creatinine clearance, ultrasound, and renal biopsy. Complications, mostly they'll be having renal failure and stroke. Treatment we can give uh, antihypertensive medications like AC inhibitors, beta blockers, calcium channel blockers, alpha blockers, and angiotensin receptor blockers. And this is about the classification of blood pressure. So the normal blood pressure is from 90 to 119 for systolic, and diastolic 60 to 79. And in pre-hypertension, that is a pre-hypertension is the blood pressure readings with a systolic pressure from 120 to 139 millimeter mercury, or a diastolic from 80 to 89 millimeter mercury. Okay, that is the main causes of pre-hypertension. The reason is unknown. So it is attributed to the lifestyle choices, like a lack of exercise and poor dietary habits. Okay, so these are the main causes of pre-hypertension. And stage 1 hypertension is a systolic pressure ranging from 130 to 139. Sorry, 140 to 159, and diastolic ranges from 90 to 99. And in stage 2, it is more severe hypertension. It is greater than or equal to 160, and the diastolic it is more than or equal to 100 millimeter mercury. Okay, and what do you mean by this isolated systolic hypertension? That is, it is when the systolic pressure is high, but the diastolic pressure is normal. Okay, so that is the isolated systolic hypertension. It can occur naturally with age, or it can be caused by a variety of health conditions, including anemia and diabetes mellitus. So mostly for the patient who are having anemia and diabetes mellitus, mostly they'll be having this isolated systolic hypertension. You can see the diastolic pressure is less than 90, so that is we consider that as a normal. Okay, if you have any doubts, you can ask me from this topic.
Thank you, Jason, sir. Participants, if you have any queries or clarifications, you can post them in the chat box. This is to all the participants. If you have any queries or clarifications, you can post them in the chat box. I'm posting the feedback link also in the chat box. Please click on the link and give your feedback for this session. I repeat, I'm posting the feedback link also in the chat box. Click on the feedback link and give your feedback. Sir, I don't find any query in the chat box, sir.
Yeah, that's okay, no problem.
Thank you, sir.
Thank you
Thank
so
you very much,
much.
sir. It was a
Okay,
pleasure having you with us today, sir. Thank you very much, sir.
yeah, welcome.
Participants, please click on the feedback link and give your feedback. The next session will begin at 4. I request you all to join for the next session also.